today's workshop's going to be on narrative therapy. I know some people have already covered this in their diploma, and others probably are thinking, I haven't heard of that yet. So, hopefully the way this is structured, it'll cover the basics of it, so you get familiar with narrative therapy, but it will also provide people with an opportunity to think about narrative therapy in more complex detail if they're comfortable with that. Okay, let's open with a definition of narrative therapy, but before I do that, for the sake of the people that haven't heard of it, this is how I would define narrative therapy to you if we were sitting out there. Narrative therapy is all about investigating the way clients construct their personal stories in their mind. So the way they see their experiences and the way they see their lives can be analysed as if they were stories. The client constructs stories, and sometimes these stories need to be reworked, these narratives need to be reworked for the client to start healing. Does that make a little bit of sense?
Yeah.
Okay, more as we go along. Okay, here are a couple of definitions of narrative therapy. I will mention that many of these slides come from previously developed PowerPoints I referenced along the way, and I have a reference list for everybody at the end. For example, this particular definition came from suicidepreventionstrategies.org. So I referenced along the way if I've considered certain slides or certain content to be useful. Definitions of narrative therapy: a way of interpreting life and its meaning through the examination of the stories about the life of the individual. A description of the life experiences that continually shape our lives, the decisions we make and the actions we take. The way we construct these narratives, the way we construct our personal stories in our mind, does impact on the way we live our lives and the way we will respond to future events and future challenges. I will print this out for you guys if you prefer.
Oh, that'd be awesome.
Yeah,
There you
yeah,
go. We'd
do
have to
that.
take
That'd be
notes.
Because otherwise it'll be a lot of writing for you. But feel free to take any notes along the way.
That would be great.
Yeah. Yeah, me too.
All right. To simplify it one more time, including for Monique, who I accidentally forgot to go and grab. I'm sorry, Monique. We're talking about narrative therapy, and another brief summary. The focus of narrative therapy is on the relationship between experience and interpretation revealed in the narrative, and attention by the therapist should be paid to the way people tell their stories rather than the accuracy of the account. So in other words, my life, in my mind, I construct stories about my life. Whether or not these stories I construct are accurate in terms of what really happened, that doesn't really matter so much as whether or not the way I'm telling them means something to me. So the way I see my life and the narratives I construct, the stories I construct about my life, it's not so, the therapist shouldn't focus so much on whether or not these are accurate descriptions of what really happened, but rather let's look at them as, to me, they're real. To me, this is the way I see things, and we work with that. You agree?
The basic tenets, I know normal use of tenets. Is that a terminology to show a fundamentalism? Or?
Yeah. It just means principles, basic principles. Yeah.
Yeah.
It's not specific to this topic. Okay, goals of narrative therapy then. The goal in narrative therapy is to draw out stories that clients have held of themselves that prevent them from moving on. To reshape clients' perceptions of themselves and their surroundings, reshaping or changing their life narratives. I'll give you an example that I'll go through later, or watch later. You guys have seen that program in treatment. I don't know, has Corey shown you Sophie's story? No. Okay.
No.
Well, we'll have a brief look at her later. Sophie is a young girl who really blames herself for her parents splitting up years ago when she was a kid. She's constructed this narrative about her life, incorporating certain beliefs, and obviously you'll see that she's not really responsible for her parents splitting up, but she believes that she's constructed that narrative. So it would be up to the therapist to help her look at that narrative and that dominant story and rework it so that she can move on and get healthy. Alright, so it's all about the client's perceptions of things. Again, another slide from a previously developed workshop, but not that there's a heck of a lot to it. Tools of narrative therapy. So how do we do it then? How do we revise and reconstruct these narratives? Well, we use things such as externalization, mapping the problem, deconstruction, and reauthoring. This would sound familiar to those of you that already hit narrative therapy, right? In your diploma. I'll give you a brief. Yeah.
What is externalization? I have no idea.
Okay, I'll give you a brief overview of each, but then we'll go into a little bit of detail. Externalization is where you have a problem, but you talk about the problem as if it's distinct from the person.
Okay.
So if I have anxiety, we call it the anxiety. Or how does the anxiety impact you on those situations? Talk about it as something external to the client.
Yeah.
Disconnecting them from it a bit. Mapping the problem is all about investigating the issues and how they present themselves to the client. Deconstruction of the narrative is linked to mapping the problem, but it's about looking at the narrative. And reauthoring is changing that narrative into or modifying it or
changing belief.
Sorry?
Changing belief.
Yeah, good. Changing the narrative from something that is detrimental, reauthoring it using new perspectives into something healthier. Okay, so externalization then. Why externalize? It separates the person from the problem. Monif might find it easier, for example, if he has an eating disorder. He might find it more helpful dealing with the problem if he sees that problem distinct from himself. Less my eating disorder, more the eating disorder. Externalizing disempowers the problem. It makes it seem less controlling over the client. Decreases guilt and blame. Opens pathways for action. Promotes cooperative effort. So now the therapist and the client can work together to tackle this issue, this problem that we've placed over here, that we've moved one step away. And it objectifies or personifies the problem. Furthermore, this is how we externalize. We give the problem a persona. So let's say and we will see this in an example shortly, let's say I have an issue, and I'm talking about it with a client, with a therapist or a counsellor. The counsellor might say, okay, so that's your issue. Why don't we give that problem a name? What would you like to call that problem? That's the first step in externalizing. We can translate verbs into nouns. We can use the patient's own words. So one thing you will notice with narrative therapies, the client certainly has a lot of control. they dictate the session. If they want to name the problem,
Juggler.
well, I was thinking more something along the lines of the anxiety.
Okay.
The anxiety, then let's let them call it that. If they want to call their eating disorder the hell I carry around, yeah, or the hungry monster or something like that, then you let them. We can list the problems when they're externalized. Sometimes clients have an easier job externalizing the problems if you write it down. And describe how the persona dictates the client's, patient's actions and feelings. So with the client, we'll talk about how this problem is dictating and has power over them. Okay? Make sense? No questions? All right, let's go to mapping the problem. Mapping the problem, like I said, is all about looking at the dominant narrative and how it presents itself. Basically investigating the issue. Mapping the problem, we understand the power of the dominant story when we do this. If a client sits down, obviously the counsellor is going to have to do their best to understand what power this dominant story has over the client, what power this eating disorder has over Monique. It might look different to the power the eating disorder has over Jordan or something. We understand the meaning of the dominant story. We understand the impact of the dominant story. We expose what supports the dominant story, and we explore the experience of the dominant story. Let's go back to Sophie. Let's say her dominant story is that she was responsible for breaking up her parents or responsible for her parents' divorce. What does that mean to her? What impact is that having on her? What supports that, those beliefs or that story? And what do her experiences of that story look like? So how do we map the DS? Well, we externalise, and we may use the investigative journalist approach, in other words, question. Use appropriate questioning. Search for ways in which the problem has affected the person at home, work, relationships. So in other words, if you're going to drop a map of this area, you're going to have to explore the area quite a bit, aren't you, to be able to drop a map. That's what you're doing here. Explore the issue, map it. Then we move on to deconstruction. Now this occurs throughout the externalizing process. In other words, we look at how this dominant story or this narrative has taken hold with the client. We look at the recruitment into the DS and the problem. We explore the assumptions made by the client, similar to CBT, similar to what you were saying before. There might be distorted beliefs. And ask if the dominant story is the preferred way of living. In other words, the client has this dominant story. Sophie, for example, with the story that she was responsible for her parents' divorce. Really, is this the preferable way she wants to see things, or is this the preferable way of living, the preferred way of living? And then we evaluate and justify the DS. Just how realistic is this dominant story? How helpful is it? Then we move on to reauthoring, and so now the client is well aware that their narrative is detrimental to their well-being. Let's reauthor it. Find contradictions. We will find exceptions to the dominant story. In other words, now that the client has investigated her narrative a bit and described it, let's ask her if there are any exceptions to this dominant story. So if the dominant story is the client feels that they are helpless in their world and can't deal with any of their problems, let's ask them of times when they've successfully dealt with a problem. And then you can focus on their strengths and help them re-author their story. Maybe they're not as helpless as they believe. Let's look at exceptions. Does that all make sense to you?
Mm-hmm.
All right.
Yeah.
What we're going to do is we're going to look at oh, I'm sorry, we better look at this first. Reauthoring, finding the exception, like I just mentioned then. What did you do that was different at that time that you're describing to me when you were able to overcome that problem? We do a landscape of consciousness. What do those experiences tell you about yourself? So you've just told me this time that this exception to the problem, this exception to the rule, this time you overcame an issue successfully. What does that tell you about yourself? What strengths that you might have, given that you've just identified this exception? And you might, of course, use supportive others to discover the true person, encourage others to join in the process of supporting the alternative story. Catherine may come to counselling to deal with a particular issue that defines her narrative, but there might be other people around her who might be able to help her identify exceptions to those rules. Now let's have a look at this session. As we're going through it, we'll see that the